So you can see her biceps femoris. Go ahead and just bend your knee. Katie, just keep it right there. Keep it right there. Just hold it right there. So you see her biceps femoris just sticking out right there. Okay. So you can have, you know, another question was, should I be doing these in prone or in sitting? Since they're, you know, both listed in your manual. If you do it in sitting, you better, you know, really describe where you're at and let me see your fingers. If you're in prone, it's a little bit easier for me to see. So, you know, if I see a tendon, you know, pop out and you come right next to it based on what it is, it's going to be a lot easier for me. On the sitting, I'm going to want you to really explain that if I'm here, I'm in between here, I'm deep in here, I'm doing this action. Whereas in prone, it can be a little bit more straightforward because I can actually, you know, see what you're doing a little bit. So both are appropriate, but I feel like anything in the back of the knee would be a little bit more appropriate to do it in prone. So that's biceps femoris. We'll do the common perineal nerve in prone. It's basically comes off of what nerve? Yeah, so sciatic is going to be tibial and peroneal, or fibular. And it's going to go into two nerves, which are called deep and superficial, fibular. So it's the same name. Common is just more proximal. Deep and superficial go down the leg. So what it's going to do, it's going to come posterior lateral aspect of the knee and kind of come behind the fibular head, posterior to the kind of fibular neck. So with this one, it is a little bit easier to do it in sitting, but because you're going to kind of strum against it just like we did the ulnar nerve, and it's a little bit sensitive. You feel it right in there. So I'm kind of posterior aspect of the fibula, a little bit more distal from the head. If you're right behind the head, you'll probably get some pieces of it, so it'll still be really tender. If you go a little bit distal and kind of, you know, strum on it, you'll be able to feel a little bit more, and you know, the patient will be a little sensitive there. So just be careful not to, you know, play a guitar string with it. Okay, that's common. Peroneal, perineal. Says you will encounter a firm, non-giving string-like structure. You can palpate it at the neck of the fibula. So that one's not too bad. I'm going to skip patellar ligament because we'll talk about that. It's kind of the same thing as patellar tendon, and we'll kind of talk about why it's called both. Let's go to semitendinosus, gracilis, and membranosus while we're here. And if somebody wants to bring a camera up to get a little bit closer, or if y'all want to, some of y'all want to gather a little bit closer, this is a tricky one if you get one of 3 of these on the test.
Does not want to be on camera, he wants to be famous.
No, it's not me. It's the back of Katie's knee that wants to be on camera. Yeah, don't get me. Get her the back of her knee. Okay. So we talked about the pes and serine being on the medial aspect of the knee. Sargent, right? The first one's sartorius, then gracilis, then tendinosus. So if she just flexes her knee, what is that muscle right there? That tendon right there? It's the tendinosus, right? Femoris and tendinosus are the 2 string-like tendons from the hamstring. So in prone, it's really, you know, easy. I can be on the medial part of her popliteal fossa. I can have her bend her knee. The tendinosus will stick out, and then I can resist knee flexion as well. Okay. So then I use the tendinosus to get to the gracilis, and the gracilis is just a little bit more kind of anterior or medial to the tendinosus. So I'll come over just a little bit, and you'll feel another stringy structure. You can't see it as well through the skin, but you can feel it just as well, and that's the gracilis. Okay? So with the gracilis, you can also do knee flexion, but to kind of differentiate between that and the tendinosis, what I'll have her do is I'll have her resist hip abduction. So I would be on the other side of her, pulling her leg out, and she would be resisting me, but for the sake of blocking, I'm just going to palpate here, and I'm just going to ask you to hold it, Katie. So I'm pushing her leg out. I'm right inside of the tendinosis. I feel it right here, and I feel it come into my finger a little bit. I can also have her kind of flex her knee. So now it's engaged, and I feel it, right? And then resist adduction, hip adduction. Okay, perfect. So we have 2 tendon structures right there, tendinosus gracilis, okay? And then we have the membranosus. And the membranosus is going to be in between the two, okay? So I can have her flex her knee. I see the tendinosus. The gracilis is right next to it. So I'm going to have to go ahead and relax. Okay? So I'm going to go deep in between the two. So you see my pressure is a little deeper. And I'm going to resist medial rotation of what? Of the hip or of the tibia? Tibia, right? So in your notes, it's going to say medial rotation. Don't get confused. Don't be asking the patient to do that of the hip. It's doing this of the tibia. So I'm going to try to rotate her leg out. Okay, relax. So she has to be kind of relaxed so I can get in between those two tendons. And then I'll bend her knee just a little bit. And then I'm going to rotate your leg out, but try to resist me, okay? Perfect. And then it's deep, deep, deep. So you see how deep my fingers are with that one. So in sitting, same thing, I can have kind of that hook approach, palpate the tendinosus right off the bat, gracilis, pretty easy as well, and then the membranosus have to be deep and kind of hook it in between those two tendons. So in your notes, it uses medial and lateral rotation of the leg a lot. I want to keep this really simple for you guys. I want you guys to do a separate motion based on which structure you're palpating. So if it's biceps femoris, it's knee flexion. If it's semitendinosus, it's knee flexion. If it's gracilis, it's hip adduction. And if it's membranosus, it's internal rotation of the tibia. Okay? So if you do all of those with a little bit of knee flexion, you'll be able to feel them come into your fingers. Cool?
Mm-hmm. Yep.
So hopefully, I really tried. That was a problem, spot last year. A lot of people were kind of, they were thinking the gracilis, that the weights listed here, tendinosus, gracilis, membranosus, was tendinosus, gracilis, membranosus, or tendinosus, gracilis. They were kind of putting them three side by side going forward medial, but it's actually, one in between the other two. So I just wanted to clear that up. All right, sartorius, let's go ahead and sit up and we can
Sorry.
come back a little bit. You can be really close, it's fine. So sartorius is a little tricky in the sense that it's you don't get that nice strong contraction that you do with some of the hamstring muscles. So it's that front part of that pes anserine, so sartorius, gracilis, and tendinosus in the very back. And so this is where the sartorius is. It's the first one, kind of in between, I would say, anterior medial of the knee. And what does the sartorius do? What action does it do?
Flexion.
Flexion. Perfect. External rotation. Right? So I'm going to ask her to do that motion like she's going to pretend to cross her legs, and I'll feel that tendon come into my fingers. Now, like I said, with this one, you're not going to get a strong contraction like the tendinosus. It's going to be very subtle, almost like you're feeling just a little bit of her skin move, and that contraction is enough. Now, I can still resist it, so go ahead. I'm going to pull you. Go ahead and bring your leg up. Hold it right there for me. There we go. So I can resist her in there, and I can feel a little bit more. But you really feel it when she just starts first initiating that motion. So go ahead and right there. It's that first instant movement. You'll feel kind of her skin move, and that's sartorius. But since it is a muscle, I do want you to get in the habit of resisting that kind of, can you flex her? Yeah, there you go. Flex her hip a little bit and come into external rotation. And so that's a muscle, the tendon that's right here, and it comes and attaches at the ASIS.